Welcome back, everyone. You are now attending the session entitled Transforming Recruitment and Retention, What We've Learned and What We Are Still Learning. And I am so thrilled and honored to introduce Noemi Shinrat, who is a Brazilian native living in the United States for 16 years. She started her career as a child care specialist and over the past 10 years has been an employee of Ford County. At Ford County, she worked mostly as a skills trainer and became a certified medical interpreter in 2018. Since then, she's been the diversity and interpretation coordinator for the agency. Besides assisting with interpretation for Spanish-speaking clients, she also assists with education of staff on class standards and diversity, equality, and inclusion initiatives. When Noemi is not working, she enjoys spending time with her granddaughter, baking, and working in her garden. Welcome, 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 Noemi Shinrat.
Thank you all, and thank you for spending this time with me today. So when we talk about my title, right, I will bring some of the class standards and some of the social determinants of health into this conversation, because I am not a HR specialist. I'm not a recruitment person specialist, right? So I bring also my own experience to this conversation. So let's go to the next slide, please. So I hope that at the end we can all identify, since I'm talking from our perspective of being a rural area, but also how you would be able to identify other areas in your location on your hiring process that can be adapted to your local needs. Also, how we can foster a welcome environment in the collaboration with the new and with the existing staff, and also how we can offer support in different areas to increase retention of the staff in our local agencies. So before we move to the next slide, let's talk a little bit about rural, right? So when we think about rural areas, the whole definition, we can find several definitions about what is rural. And if we pay attention, most of them starts with an exclusion. So rural, mostly it's not urban. So rural does not have this amount of a population, or rural doesn't have this particular aspect. So we have a lot of these exclusions already in the whole definition of rural on itself. So when we talk about cultural competence, we could add another layer of being cultural competent in the rural culture, in the rural area, right? And when we think about this, is very important also to understand that we have basically, according to the Department of Agriculture, 15% of the United States would be considered with rural areas, right? But then also when we think about our particular areas, this plays a huge role because we have fundings. We have not only from federal and state level, but also from private sectors that they're going to look at the size of our population to allocate resources. And then comes also with some of the characteristics for rural areas that are the same characteristics in some areas, but we cannot say again one size fits all when it comes to rural areas, because each one also has some particularities and some differences, but also there is the things that are common. So for example, some of the common issues is that we have an older population. Sometimes we notice the lack of privacy, right? Like everybody knows everybody that knows somebody. We have the poverty, right? Because again, when we are talking about allocation of resources, even private investors, there are some investors that they are going to put their business in their area because they say, well, we have that target population and then we are going to invest in that particular area. And then we have the situation of greater multi-generational caregiver, right? So we have a elderly person in the home that somebody takes care, or a grandparent that takes care of a grandchild. So these are some of the aspects. And also we have some of the values. And we are going to come back to some of them a little bit later, that we have the self-reliance. Well, I can do it. You know, I don't have to go see a mental health professional because I can brush it off. I can move on. We have also the conservatism, right? Like, I'm not going to change. This is not going to change. This town has been like this forever. There is the aspect also of a certain level of distrust from outsiders, right? Somebody that comes from outside, it's quickly noted. You can hear the statements like, you are not really from here, are you? And also we have that big work orientation. And this is where we came to evaluate our role on this, right? Because as I mentioned before, even private sectors to invest in rural areas. Why do we see more fast food restaurants? Why do we see more gas stations, right? Because those are the things that more likely, yeah, people need gas, even if they live in a small little town. They need gas to go from point A to point B. They need to eat, so let's have this particular chain of store here, and let's have that particular restaurant there. And these places, they become a greater focus of first employment, right? And in a rural area, that represents also that some people think, what is here for me? There's nothing. I'm going to work on this place or that place, and that's it. And then as a consequence, we, like, noticeably for all of us in this area, we know the shortage that we have in mental health professionals, not only skills trainers, but also the more specialized ones like psychiatrists, therapists, social workers, and so on and so forth. So with all this information in our hands, I thought, okay, I am the diversity and interpretation coordinator. So is there anything on the class standards that I can look at that may help me? And sure enough, there was. So next slide, please. So when we think about class standards, right? There are some in particular that really, if we go back to 10 to 13, right? They basically talk about conducting ongoing assessments in the community, right? Assessing the needs of the community, collect and maintaining accurate and reliable demographic data, partner with community to design, implement, and evaluate policies, practices, and services to ensure the cultural appropriateness of services. So over the course of the years, for example, in 2017, thinking about clients, probably we would have 30 clients that were Latino or Latino descendants that were being served at that time. When we implemented and we made the population more aware, right? About we offer language assistance. We have somebody that is qualified to do interpretation in person. We don't have only the option of language line. Over the course of the 4 years, we went from 30 to about 200. And for some areas, the 200 may think, 200, it's not a big number. But for us was, but it's not still where we want to be, because think about the demographics, particularly talking about Cass County, our population, about 14% of the population is Latino or Latino descendant. And then thinking about clients took us to the hiring process. So what do we have? So when think about if we offer perks, we do. We have a referral program. We have a differential pay if you are bilingual. So we have that, right? So that's good. But then our staff is aware of that. Is our staff aware that they can refer somebody, and if the person remains in the job for a certain time, they also are eligible to receive a bonus for that referral, and so the person referred to the job. So this is information that we have. These are the good things that we have, right? We have trainings on equity, diversity, because those are not only the requirements that we have, but we want to grow in several different areas. So, okay, we hired people, but now what? We are still not where we want to be. So next slide, please. So we start noticing that one of our local health clinics, pretty much everybody in the front desk was bilingual. And then we're thinking, what do they have that we don't, right? Well, to start with, we had that thing of the front desk staff, pretty much all of them being bilingual. So how does our community see us? What do they know about us? And how often we see people, do we have people coming and asking for application? We know that with the whole pandemic process that we went through, and even before that, a lot of people were preferring to get an application online and apply for a job. And thinking about your area, right? Are you more rural or are you more urban? So that it's great influence how people also look for jobs in your area. So one thing that caught my attention, it is I have this great mobility of having sometimes this first contact with people, right, for doing interpretation. And we start noticing that few people would come for an initial assessment, for an intake, and you'd say, what is this place? Do you only offer psychiatric services? And then we would be surprised when we would explain, oh no, we offer skills trainers, we offer adult service group, we offer therapy, we offer skills-based for home and school for children and adults. And people would say, oh, I didn't know. I thought here you're just like, if you were in a crisis, you would come. So that also starts to work on the back of our heads, like we are well established here, right, for 30 years. So what is it missing in this puzzle, right? And part of that answer came with more frequent than not, we think about how the social determinants of health, they influence our clients, and then we try to put through a different lenses how we can influence the social determinants of health in our community, right? Because not only about talking about the health portion of it, but also employment, right? Job security, it's a big part of that for your community, for any community. Also, increasing the support system. So if we have our skills trainers, we have more skills trainers capable to serve not only our English speaking population, but also our diverse population. We are able to make more changes in more people's lives. And then if they increase their social support, if they do better, the community also does better. So next slide, please. So then comes to the part, we are 4 county, right? We are in more than 4 counties, but we are 4 county. And again, going back to some of those common characteristics in rural areas, public transportation is difficult. So if you don't live nearby that you can go on a walking distance, you are going to depend on the transit that operates certain times of the day. They have like certain set rules that if you have a situation that you need to go right away, you may not have the transportation to go because you didn't plan ahead of time. So we have all of these components when it comes to a barrier for people most of the time also to make to their appointments. The demographics for us have changed a little bit. We have experienced an increase in the Burmese population for a while, but now Haitian population, and it was brought to my attention that we even have some people from the Republic of Congo in our area. So we are very diverse, right? In that making of different people from different ethnicities and races coming to Logansport and our surroundings. And Logansport, it's where we have our main building, right? That we call main center. And our HR department, it's not in the same building. So we have a different building for our HR department, that the administration, it's another building. And we are locating services for therapists and everybody in another building that it's the building that I actually am and work most of the time. But Logansport, for many, many years, and maybe some of you may have the recollection, that it was referred as the town for the state hospital, right? It's like the only thing that exists in Logansport. Oh, the state hospital, where you have the hospital, you know, for people with mental health difficulties. And that makes us think, okay, so some of our locals have no idea who we are, what we really do. So next slide, please. So then what we did, we start thinking about, we put all of these components together, right? And thought, some of these things really we need to do something about it, right? So we hired a recruitment specialist. We hired somebody called Stephanie. And probably I had a little problem when I send my slides, because But I will read to you a little description about Stephanie. And maybe at the end, everybody's going to say, oh, we need to hire Stephanie too, right? And I hope that you all at the end also can find your Stephanie on that. But Stephanie Prisfield, it's a local. She grew up in Cass County, and she has been a resident of Cass County for many years. And she's a wife, and she has two beautiful girls, high school age girls. But Stephanie has also worked in the mental health field for 25 years, and working doing direct care, as well as recruiting, mentoring, and training those that have the desire to start working on the mental health field. Stephanie has a passion to reach out and find people that have the heart and the strength to serve those that have the desire for the mental health area, health support. And before Stephanie, we were going to job fairs. We had flyers in English and Spanish. So I recall going to one particular job fair with Stephanie. It was in Plymouth, and we had to use masks during all the requirements and all of that. But we had the tables set, and people would pass by our table and they would ask us, oh, what are you guys do? So what is for county? And we would say, oh, we are a mental health facility. Oh, okay. Would you like to know more about, oh, no, yeah, oh, or we even hear statements like, oh, yeah, I have somebody that has some anxiety or depression. And so the conversation would take another turn. And Stephanie basically put together a lot of what we are thinking before, a lot of those principles, those standards from 10 to the 13. And Stephanie was able to come together with all of us and say, let's have a plan together, right? Let's see, we know what we have, but let's see how we can improve and try to get what we don't have. So Stephanie became very active, also going to the local radio station. I have participated, like some of you, in some other previous webinars that we got amazing suggestions, like saying, oh, we put our logo in the Indigo bus, for example. And let's go back, we're in a rural area, we don't have Indigo, right? And our transit, they do not allow any kind of advertising on it, so we are limited on that. And we don't have a bus stop because we don't have public transportation. So we really have to be creative. We really have to think out of the box. So Stephanie started also implementing, like going to the local radio, and she would not only promote the services, but also promote the opportunities. What it started making a lot of difference. And listening to Susan Clifford before, it really inspired us even more, because Stephanie started working with the local schools. So Stephanie goes to school. She developed this amazing relationship with the school corporation, and she can sit her table in there, and you know how we have career day. So some of them may think, oh, I have this desire to help people, but I don't know, I don't want to be a nurse, or I don't want to be a doctor. I want to do this, or I want to do that. Have you considered the social work field? Or, maybe you would like to give it a try. We have some positions that require this and this qualification, and it's a good start for you, right? And again, referring to Suzanne Clifford before, going back to those characteristics, right? The caregiver part. So you know your community, you know the needs, you know a lot. So this gives you a lot of tools that you know your area, right? That reduces a lot of the distrust from an outsider when you are the person that knows your community. It's a huge contribution. And then thinking about how people look for jobs in your area. In our area, and probably in big areas like Indianapolis and Lafayette areas, for example, you may not see as frequent, but for us, we start having this small cafe stores, right? Coffee shops. So these coffee shops, they are actually a huge, huge hub for people to look for employment. And Stephanie was the person that had that aha moment and said, hey, you know what? I am going to use this on her benefit. And then Stephanie created the Coffee and Career. And Stephanie goes to different counties. And what Stephanie do is Stephanie goes to these coffee shops. So remember, we talk about some of the investors, private sectors, and so on and so forth, right? And it's important to think also that in some rural areas, access to high-speed internet, it's difficult, it's scarce. And even this idea that everybody has internet, right? If there is another myth that the pandemic helped us to debunk, was that because we had a lot of kids that they couldn't do their work. They didn't have how to access remotely because they didn't have internet. So Stephanie, besides going to the library, because it's important to think that sometimes in your community, your library can be also this huge hiring opportunity space that people go to have access to the internet, to the information, right? So Stephanie created the Coffee and Career, and then she started attending those events. So next slide, please. Next. So we start thinking about, let's invest more on our brand, right? Let all the people out there know what we do, right? So we became, again, more present in this job fair events, but also we became more visible. We start saying, hey, you know what? That this may be a great place for you to work at also if you want to start your career, if you want to go back to the workforce. And we are more than prescribers. We are more than, and this is a message that we felt that it was missing in our community. It was a piece that people didn't really have that cleared. Oh, I can get a job there too. Oh, I didn't know that I could work there. Oh, I'm a medical assistant. Do you guys hire medical assistant? Yes, we do. And Stephanie, for having this experience working in the mental health field, also assists us to see potential where maybe some other people may not be able to see. So one particular aspect of being in an area like Logansport, we also have a armory, a National Guard headquarters here, right? And then we have a lot of recruiters. We have a lot of people also that sign up, youngsters, and then they come back. And then sometimes they think, well, what am I going to do? I am out. So what are my options? And I'm pretty sure that if somebody stopped at a table and talked to Stephanie, you would be able to say, hey, no problem. You know, I know that with your military experience, you may be very self-disciplined. Maybe your area of expertise in the military require you to develop a very good sense of paying attention to details, right? So when we are able to give this message to people that you have skills that are helpful not only to us to fill a vacant position, but it's a position that you are going to fill, and also in the long-term effect, it's going to help the community. This makes a huge difference for all of us, right? So that's why it's important to have this awareness, to have this data of where do people meet? You know, where do people in your community usually get together? In rural areas, how often people buy the newspaper? Because for a long time we had also in the newspaper, right? And in doing all of this doesn't mean that we quit doing those things. We still do those things. We still have the ads in the newspaper. We have on some other websites, but also we had this focus towards the community, right? So you live in this community. So hopefully you also find that it's going to be a very good opportunity for you to start working here as well. Going back to the example of the health clinic, we start thinking about, you know, they have flexible hours. Well, with skills trainers, also they can have a little bit more flexibility of schedule, right? They have Saturdays and Sundays off. Normally, the skills trainers also have Saturdays and Sundays off. The differential of pay, what is the differential of pay from there compared to here? And that's when also called our attention to see that most of the front desk staff, they're younger people, right? They were younger parents that need to have that flexibility. When we think about younger parents, younger mothers, we are thinking about they need the flexibility to get the child or from school or to the child care or to a parent to care for, or they use their lunchtime to move the kid to point A to point B so somebody can take care of them until they're done. So how about we also let them know that we offer positions that they can achieve that, right? They can do all of that. We have things done in a way that that message is given in a more clear manner, right? So it's like we are more than prescribers again. We do more than that. And thinking about, again, as I mentioned before, when we think about the social determinants of health, we can contribute to make the difference in the community. Next slide, please. So then we pass through this hiring process, and then if you ask me, so how it has been going on for you, Noemi? I can tell you that over the past few months, we have had a steady number of people being hired. Not a huge number, but has been steady. And on Mondays, our CEO, she normally has announcements that she also congratulates those that are having work anniversaries. And it has become more frequent, the number of people that we have that it's here for about a year, right? That is the first work anniversary. And then we have more that have 2 years work anniversary. And one piece of this data that has called our attention as well is we have people that have left the agency, but then they came back. And that was a piece that it was very important for me to put together and understand that we are going to have people, especially when we talk about younger people, right? That they are trying to find where to go or what they're going to do. So they may come and stay with us for a year, for example, and then they may go back to another state or to another town, another big center for college, for example. And that's okay. But if we can create their work experience in a way that even when they leave, they can say to others, hey, I started my career there. I think this is a great place for you to start. That it's also a positive. That is a very, very good marketing that we cannot get anywhere else, right? It's something that comes from somebody that it's from the community. It's not an outsider, it's from somebody that has the lived experience. And then again, as I mentioned before, some of them, yes, they go, they get their degree, and after that, they decide to come back. So all of this are good results, but all of these results also take time. It's not something that we saw happening like from night to day. It's something that we saw that took a little bit longer to happen. And we just really need to have faith on the process. What it's not something that sometimes we are very patient about, right? So then we make all this effort, we did all this work to have people hired. So then we start to get in a better number, we start to get things a little bit better. So now what? You have a new staff starting here. And then they come at the first day of the job and say, hey, hi, my name is Joanna, for example, right? So what we are doing after all of this hiring process also is vital for the retention. And we also have to work with our current staff to be the welcoming staff and create a welcoming environment for the new staff, especially when we talk about younger staff, right? So when we talk about some of the characteristics of rural area, we have the factor, like I mentioned before, older population. There is that worry about work stability, right? So for example, I am 53 years old. If I don't work here, where am I going to work at? Do I have options on my surroundings? What are my options? And then when somebody new come, it's important for us to make clear, and even for us as putting this effort on hiring new staff, that it's like well mentioning yesterday by Dr. Rudnick, we are trying to fix the process. We are not trying to fix the people. We need to try to fix the process. So how we can put that in our work. So we are trying to improve the process. So we are hiring new people. So the existing staff can have also a better condition of work because we are having a better flow of the process, right? You're not going to be so overwhelmed now, we hope, because we have people to share that caseload with you. We have more people being trained and able to do that. So new staff, even new positions that are created in the agency, doesn't mean that we are replacing the existing staff. Doesn't mean that we are replacing or eliminate positions to reduce the creation of jobs and positions, when we are actually trying to do the opposite, right? And then also, when this is new staff comes, it's important for them to know, like, the orientation process, right? How is our orientation process? So it's important to let them know, if you have this problem, you can contact this person. So this is her email. All of this, it's very important, because nobody wants to be hired and say, well, I don't know what to do. I don't know where to go, what I do next. I have this problem and I have nobody to ask for. And this in all levels of agencies. And that includes me, for example, right? I have a new skills trainer starting, and that person said, I got this call from this parent from the school. This parent speaks Spanish. I cannot talk to them. Yes, you can. You contact me. So if you have any problem like that, get a hold of Noemi. And Noemi will help you to guide through the process. And then we are going to have, for example, a three-way call. She's going to interpret for you while you talk to that parent. Explaining the procedures and policies that they need to be familiar. This is huge. It's huge, because you don't want to be that person thinking, am I the only one that I don't know how to do this? What it's discussed before, that feeling of belonging, when I know what to do, when I know what the agency expects from me, I feel less stressed. I feel more comfortable. I know who to go for to ask for the questions. And when we talk about thinking about what Dr. Viz said yesterday, right, about mentoring, we have also that process of job shadowing, right? Let's have somebody to job shadow you, for example. So it makes a huge difference when you have somebody that is willing to do that. Not everybody may feel comfortable. And that's another thing that we had to understand, that we are all working in mental health, but we are all individuals that may have different level of social comfort, right? I may do things very well when I am on my own. I may not be a very small talker person. So maybe if you have somebody to job shadowing me, give that person a heads up and say, hey, this person is willing to have you job shadowing her. She may not, you may get to know her better, and just don't feel like you are not appreciated or something, because maybe that person doesn't talk a lot, but that person is great on what she does, right? So let's focus more on the strengths of each one of us, what we can do to improve the process. And as a mentor, as somebody that you have a new person coming to job shadow, to make sure that, hey, you can count on me. I'm glad that you are here. I will teach you all that I can. If you have any doubts, please feel free to contact me, because this gives a total different message when sometimes even an unintentional microaggression may happen, when somebody says, oh gosh, another new person started and it's going to be stuck with me again, right? So all of this makes a huge difference when we are trying to do all of this effort to hire, and then how to retain the staff that is currently here. And during the staff meetings, maybe even if they are virtual, it's still Let's to make sure to connect. Let's to make sure that the new staff and existing staff, they can connect. They know who they are, right? In our facility, we have the policy to have our badges when we are in the facility. So let's encourage that and say, oh, hi, what's your name? Oh, hi, nice to meet you, right? It's just something that we can also leverage in order to make sure that people to feel welcome, right? Like, hey, I know that person. Oh, hi, I just met so and so. I would like to introduce you. She's the new skills trainer. All these little things, they make a huge difference on the sense of belonging. And next slide, please. And then we have, there is one before that, maybe? Okay, so let's continue those conversations, right? Let's continue thinking about how we can bring more representation from our community to our local offices, how we can promote our work, how we can promote who we are, how we can have those discussions. And once we have this diversity coming from the community, this newcomers, let's also giving them the opportunity to equally succeed like the ones that are already here. Let's give them what they need to succeed. It's a journey for all of us. We are all in this to succeed together. We are not wanting for you to fail. We want you to succeed. And in order to do that, we also need to be prepared to listen. Let's listen to you. What are the difficulties that you're having? Making sure that we know all of these components and everything prior to somebody leave the agency, right? We don't want to be talking about those perks of college tuition assistance, differential pay, bonus, even some other opportunities. We don't want the person to know that when they are leaving the agency for whatever reason. We want to make sure that they know that when they are hired, that when they are becoming their journey with us, so they are aware of what we have. And I will finish with a quote from Brené Brown that I particularly think that it's represents a lot when we talk about the listening aspect. When receiving feedback, we can identify a value supporting behavior or a piece of self-talk to help in the moment. Here's mine. When I'm receiving feedback and I want to stay aligned with my value of courage, I say to myself, I'm brave enough to listen. And I think that it speaks volumes when we can do that, right? When we can have the courage to listen. I'm going to listen to what you have to say, so then we can possibly identify where the gaps in the process are, so we can take the measures or even start to think about the measures to fix that. And so on my last slide, please, you have my contact information. We have our fantabulous Stephanie Pursfield contact information, and on our website you can find some more information. But it was really a pleasure to be with you all today and sharing some of our experiences here in our little corner of the world. Thank you.
Thank you so much. That was a master class in recruiting and retention. The compliments and the overall comments coming in are saying, thank you so much for doing a detailed, diligent breakdown of exactly what are the steps, what are the mechanisms, and what are the tactical ways to ensure that our new hires are supported. And what a great opportunity to do a micro practice of mentorship by having a organizational team member be partnered with a new hire and not quote unquote overcapacitating somebody that is meant to do that work from an HR profession, but spreading that across the entire team and what organic relationships are built. I think that's a wonderful exercise in what Dr. Valles shared yesterday. So we've got some great comments for you. It says, great job, Noemi. I admire your passion and diligence in this area. Thank you for the tactical breakdown. Wow, we need to do this in our organization. And so thank you so much. There are a few questions that I'd like to just kind of consolidate in the efforts of time and just in efforts of duplication as well. When we look at the work that you are leading and how you are already a leader, a manager, a cross-functional, how do we find the you in our organizations?
So before we started today, I was talking to Kelly, right, briefly. And let me share with you what I shared with her, that I think that you already have one of me in your agency, right? Truly, you have that. And I said to Kelly that Dr. Cadwell, that is our CEO, she took a huge leap of faith when she allowed me to occupy this position as a diversity and interpretation coordinator, because there was nobody before me that had this position. I didn't have a predecessor that I could look as a mirror and say, oh, this is what this person was doing, and we can continue that job. So she took the time and she noticed me. She noticed me like, hey, there is that person that she is bilingual. So, hey, maybe we can, see what we can go with. And then I had along the way, in this last 4 years in this position, I have had also an incredible supporting supervisor that she gives me the challenge, but she also supports me and say, okay, you don't have to do this work alone, what we can do to support. So I really would encourage you to look at your local agencies and look for that particular person. You may find somebody amazingly passionate about what they do in your agency. And I am sure that, everybody has one. It's just like to have the courage to unleash that, right? So let's let that shine. I really appreciate all the comments and all of you spending time with me this morning.
Thank you so much. For more information on this wonderful masterclass, we do have Noemi's slides on the Networking Cafe with the presentation in a PDF format, and of course, her contact information here. When you look at the next steps for your organization, what are some things, even with these amazing processes and internal almost standards, right, in place, what else are you looking towards as far as culture and improvements to culture and areas of opportunity for Four Corners?
It's interesting. It's interesting you asking me that, because sometimes I tell my supervisor, I said, I have the impression that I'm not doing any work. I'm not doing anything. I don't. And but we have a lot that we need to work on. So we have projects also to improve the ability of the skills trainers to work with another segment of the population, especially looking at the juvenile population, not on the aspect of the criminal justice, but also on the aspect of our youth that may be having issues with their own sexuality, right? That they identify as a LGBTQ community. So you're a skills trainer, you're working with the kid, but you are also working with the parent. So how we can give you the tools that you need so you can succeed to work with both. Because sometimes what we have had the courage to listen and learn from our skills trainers is that sometimes it's difficult because the parent sometimes come to you as if you could be a therapist as well and say, oh, I want you to fix my child. I want you to fix, I want them to go back as where they were. And it is a very delicate territory to walk through. So we want to improve the ability of our skills trainers to work with this particular segment of the population. And we may also take another dive, another look on how we can also assist and be, I wouldn't say more effective, but how we can be more present with our crisis teams, right? We have a mobile crisis team, and then they use late hours of the night, for example. They are not going to call me. They are not going to say, oh, I'm going to wake up Noemi and call her. But they may prefer to use language line. So even if somebody's seen by our mobile crisis team, to assure that after that moment of crisis, we can still provide the best cultural competent care for that person in the continuity of the process. So we still have a lot of work to do, but I think as of now, these are some of the things that we are going to move forward, as well as continuing to do. We are in the process of revising our policies that are related to our cultural competencies and trainings. Actually, we have a meeting this afternoon about that. So we are in the process of revising those. So there's a lot of work in the background, and that's exciting.
I mean, and thank you for being so clear in the areas that the organization could work on. It is so complex, our family relationships, and what, or rather how youth come to us for services under the, some cases, insistence of their parents for whatever reason, and whether or not we agree with those reasons, still being able to support the youth in their empowerment of their identity. And so we, as all organizations, as we work with individuals, all have the opportunity to aspire to be better listeners, better skills providers, and overall better trained to support the complexities of what our patients are experiencing and how they came to arrive at care. So I greatly appreciate you utilizing such a very specific example and a very vulnerable population today that may not arrive for what they are being presented as needing, and more so probing deeper into exactly how we can help our youth in their continued development of their resiliency in this ever-changing and complex world. There is one additional question from the audience, simply wanting to ask you to expand upon the anecdote that you mentioned regarding a African-American woman coming to your organization recently, and just repeating or supporting the clarification on that story.
So we have people, as I mentioned before, we demographically speaking, we are a lot of Latino and Latino descendants, right? Including me. So, and we have this increase now in the population that comes from Haiti, and not everybody that it's a person of color in our agency is from Haiti, right? Not everybody that comes for services is from Haiti. But we are really working towards making improvements on this part of that comes a lot with what Jody Ann said yesterday, that it doesn't matter. Your color doesn't matter who, it does matter, but you need to be treated with respect, right? So if you're an African American descendant, if you're an African American person, you have to be treated. You have the right, and we owe this to you. We need to treat you with the same respect that we would treat you. And if you come here, I guarantee you from my end, I am greet you with the same smile, with the same I don't know, with the same, enthusiasm that I have, that I would talk to a Latino person if I was speaking their language, or when I speak English, or even when I don't have the opportunity to speak my native language very often here. But you are going to get that same treatment. You have to write to that, and we owe you that. And this is a work that you say, yeah, that comes from you, but how about the rest of the agency? And this is a continuous work. That's like, yeah, that's a work in progress. We have to work with everybody. That's why we keep always thinking and revisiting. Yeah, we have the class standards. We have all of those materials to guide us. So let's revise it. Let's do a review again and repeat and again, because we are not going to change how some people think, right? Some people, they are not going to be always open to discuss about diversity, about equity, but we still have to carry on that conversations. I hope that I answered the question.
No, I mean, thank you so much. And absolutely, I think with that clarity, really echoing the sentiments that we provide a standardized level of customer service and welcome at Ford County, and that has been adopted as a standard into the culture of how the work is being done. And so thank you for the question for our participant, and the participant did respond. Thank you very much for the clarification of that example. And so Noemi, again, thank you so much for your support today. Your, again, masterclass in retention and recruitment in an environment where mental health and addictions providers are really seeking additional capacity, capabilities, and competencies within the workforce. Thank you again for being with us today. We are going to head to a 30-minute break where we have more networking cafe. Noemi's slides have been added to the conference presentations for your further reference. We will come back together at noon Eastern for a presentation by Superintendent of Indianapolis Public Schools, Alicia Johnson, where she will be sharing reliving COVID-19 organizational adaptability during the pandemic, of how IPS has accounted for crisis change management on a systems level. Until then, thanks everyone for participating, and we'll close this session.
Thank you.